Fatty liver disease. It sounds exactly like what it is, a condition where fat accumulates in your liver. While a small amount of fat in the liver is normal, too much can become a serious health problem. It's a silent disease, often showing no symptoms in its early stages. Yet, it affects a staggering number of people. There are two main types of fatty liver disease: non-alcoholic fatty liver disease, or NAFLD, and alcoholic fatty liver disease. As the names suggest, NAFLD is not caused by excessive alcohol consumption. Instead, it's linked to obesity, insulin resistance, and high cholesterol factors commonly associated with metabolic syndrome. Alcoholic fatty liver disease, on the other hand, is a direct result of heavy alcohol use. The good news is that fatty liver disease is often reversible, especially in its early stages. Understanding this condition, its causes, and how to prevent it is crucial for maintaining a healthy liver and overall well-being. In this exploration of fatty liver disease, we'll delve into its causes, symptoms, diagnosis, and most importantly, the steps you can take to prevent and reverse its progression. Your liver is a powerhouse organ, responsible for filtering toxins, digesting food, and producing essential proteins. When fat infiltrates this vital organ, it disrupts its normal function, leading to a cascade of health issues. By understanding the causes, symptoms, and treatment options for fatty liver disease, you can empower yourself to make informed decisions about your liver health. Why does fat build up in the liver? There isn't just one culprit, but rather a complex interplay of factors. Let's break down the main players: diet and lifestyle. Our modern diet, laden with processed foods, sugary drinks, and unhealthy fats, plays a significant role. These foods contribute to weight gain and insulin resistance, both strongly linked to fatty liver disease. A sedentary lifestyle characterized by prolonged sitting and lack of physical activity further compounds the problem. Obesity. Excess weight, especially around the abdomen, is a major risk factor. Fat cells release inflammatory substances that can damage the liver and promote fat accumulation. Medical conditions. Certain medical conditions, such as type 2 diabetes, high cholesterol, high triglycerides, and metabolic syndrome, increase the likelihood of developing fatty liver disease. These conditions often go hand in hand with insulin resistance, a key driver of fat storage in the liver. Alcohol consumption. Excessive alcohol intake is a direct cause of alcoholic fatty liver disease. Alcohol is toxic to liver cells, and chronic heavy drinking can lead to severe liver damage. Understanding the causes of fatty liver disease is the first step toward prevention. By adopting a healthy lifestyle, managing your weight, and being mindful of your alcohol consumption, you can significantly reduce your risk. Fatty liver disease isn't a one-size-fits-all condition. It exists on a spectrum, ranging from mild to severe. Understanding the different stages is crucial for appreciating the potential seriousness of this disease. Simple fatty liver, or steatosis. This is the earliest and most common stage. Fat accumulates in the liver, but there's little or no inflammation or damage. Most people with simple fatty liver don't experience symptoms and may not even be aware of the condition. Non-alcoholic steatohepatitis, or NASH. In this stage, fat accumulation is accompanied by inflammation and damage to liver cells. NASH is more serious than simple fatty liver and can progress to more advanced liver disease, fibrosis. As inflammation persists, scar tissue or fibrosis begins to form in the liver. Fibrosis disrupts the liver's normal structure and function. Cirrhosis. This is the most advanced stage of fatty liver disease. Extensive scarring replaces healthy liver tissue, impairing the liver's ability to function properly. Cirrhosis can lead to liver failure, liver cancer, and the need for a liver transplant. While the early stages of fatty liver disease are often reversible with lifestyle changes, the later stages can have serious and potentially life-threatening consequences. One of the most insidious aspects of fatty liver disease is its silent nature, especially in the early stages. Many people experience no symptoms, making it a silent threat that can progress unnoticed. However, As the condition advances, certain warning signs may appear. Fatigue. Feeling constantly tired, even after a full night's sleep, can be an early indicator. The liver plays a crucial role in energy metabolism, and its dysfunction can lead to persistent fatigue. Abdominal discomfort. A dull ache or feeling of fullness in the upper right abdomen, where the liver is located, is a common symptom. This discomfort may be worse after meals or when lying down. Yellowing of the skin or eyes, jaundice. This occurs when the liver can't effectively process bilirubin, a yellow pigment produced during the breakdown of red blood cells. Swelling in the legs or ankles, edema. Fluid retention can occur due to decreased production of albumin, a protein made by the liver that helps regulate fluid balance. It's important to note that these symptoms can also be caused by other health conditions. If you experience any of these symptoms, it's essential to see your doctor for a proper diagnosis. Diagnosing fatty liver disease requires a multifaceted approach to accurately assess the extent of the condition. Here are the common methods used. Blood tests. Liver function tests measure the levels of certain enzymes and proteins in the blood that can indicate liver damage or inflammation. Elevated levels of these markers may suggest fatty liver disease, but further testing is usually needed to confirm the diagnosis. Imaging studies, ultrasound, kinetic scans, and MRI can provide detailed images of the liver, allowing doctors to visualize fat accumulation and assess the severity of the condition. Ultrasound is often the first-line imaging test due to its accessibility and affordability. Liver biopsy. This involves taking a small sample of liver tissue for microscopic examination. It's considered the gold standard for diagnosing fatty liver disease and determining the stage of the disease. A liver biopsy can distinguish between simple fatty liver and NASH, which is important for guiding treatment decisions. Early diagnosis is crucial for successful management of fatty liver disease. If you have risk factors such as obesity, diabetes, or high cholesterol, talk to your doctor about getting tested. The good news about fatty liver disease, especially in its early stages, is that it's often reversible with lifestyle modifications. Here are the key strategies for prevention and treatment. Diet modification. Adopt a healthy, balanced diet rich in fruits, vegetables, whole grains, and lean protein sources. Limit saturated and trans fats, added sugars, and processed foods. Regular exercise. Aim for at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week, along with muscle strengthening activities at least twice a week. Weight loss. If you're overweight or obese, losing even a small amount of weight, around 5 to 10%, can significantly improve fatty liver disease. Gradual, sustainable weight loss is key. Alcohol reduction or abstinence. If you have alcoholic fatty liver disease, it's crucial to stop drinking alcohol completely. For others, moderate alcohol consumption is generally considered safe, but it's best to discuss this with your doctor. Managing underlying conditions. Controlling conditions like diabetes, high cholesterol, and high triglycerides through medication and lifestyle changes is essential for managing fatty liver disease. By making these lifestyle changes, you can take control of your liver health and potentially reverse the effects of fatty liver disease.
Fatty liver disease is a growing health concern, but it's often preventable and reversible, especially in its early stages. By understanding the causes, recognizing the symptoms, and adopting a proactive approach to prevention and treatment, you can safeguard your liver health and overall well-being. Remember, your liver is a resilient organ. With the right lifestyle changes, you can give it the best chance to heal and function optimally. Don't wait for symptoms to appear. Take charge of your liver health today and pave the way for a healthier future. Your liver will thank you for it.